Tell us about some mistakes you've made. Did you ever look back and think, oh my God, I can't
Where
believe
do I
doing this,
start?
doing that
Oh
other
my
business
goodness.
or injecting?
Okay, I actually remember the first mistake I made was
Tell us about some mistakes you've made. Did you ever look back and think, oh my God, I can't
where
believe
do I
doing this,
start?
doing that
Oh
other
my
business
goodness.
or injecting?
Okay, I actually remember the first mistake I made was that I learned a lot from. I did my first set of lips on the receptionist at the clinic I was working at. And we did a good job. We were pretty proud, the receptionist and I. We were like, yeah, man, that looks good. And some of the other staff were like, wow, her lips look good. So I was like, I'm so good. And then 6 months later, we were like, okay, 6 months. This is how long it lasts at 6 months. And the receptionist was like, I think we need to do these again. So I thought, okay, well, that treatment worked. Therefore, I'm going to do the exact same thing again. And at the time, we used a technique where we would outline the vermilion border and then we'd do these horizontal threads. And so I thought, right, well, if it works so well the first time, I'm going to do the exact same thing. Yeah. And so I did the exact same treatment 6 months after first treating her lips, and I redid her vermilion border and I redid it all, and it didn't look the same. Her border looked thicker. And I remember thinking, that's so weird. It's supposed to only last 6 months, but it kind of looks like she's got a double dose in her border. And I don't really like it as much, but it's almost like it's gone from the red part of her lip. And I remember looking at that and thinking, okay, that's a lesson. And I need to, filler doesn't dissolve or break down at exactly the same rate in exactly the same places. And you can't just replicate the same treatment that you did the first time to get the same result. And that was the sort of the first inkling I had that you have to assess every single time you do a treatment. Yeah. And that filler can last longer in some areas than others. And it can last longer than 6 months, even though we used to think it lasted 6 months. Yeah. So there was kind of opening up a whole world of stuff that we talk about a lot now, right?
I imagine that mistake is happening day in, day out across 95% of clinics still. Yeah. Because
should I try and tell my patients, Jake? I'll come back. I see patients. I think it's fascinating how long filler can last, and that we know now that it lasts a lot longer than 6 months.
Yeah. What's your sort of stance on using ultrasound for dissolving, dealing with occlusions potentially, pre-scanning for high-risk areas? So temples.
Look, I think it's fascinating. It's a fascinating area, and it's on my list of what I want to learn. So I've worked with ultrasound a lot because I used to do ultrasound-guided sclerotherapy, where you are basically trying to inject into vessels. Yeah. And you've got an ultrasonographer with you, showing you the whole time. Yep. And from that, I learned, firstly, ultrasound is a long learning curve. Mm-hmm. So it's quite a difficult thing to do. Particularly, it was hard enough to do with vessels that were sort of 1 to 3 millimeters in size in the leg. It's a lot harder in the face. I think it's a tool. I really want to learn it, but I know that it's going to take quite a lot of effort. Mm-hmm. And I think that it's going to be incredibly useful to advance our knowledge about what is happening under the surface, with a whole variety of things, with adverse events, but with also safety, as you're saying, identifying vessels first. I think it's got a future, and I'm prepared to put some work in.
Yeah, well, we just had Dr. Steve Harris on a couple of weeks ago, and he basically implemented it into his practice now as a pretty standard thing. And he reckons that the learning curve was difficult, but he seems to be fairly comfortable with it. He's using the Clarius machine, I think he mentioned, and it's
interesting. Yeah, because so Paul has got the Philips Lumify, right, and that's the one that Leonie Schelke was interested in. And so I was booked into the Melbourne ultrasound workshop that was supposed to happen in that first lockdown about 2 years ago, and since then there's been no conferences, so we were all kind of amping to go and learn it all. Paul Nola's wife Fleur is a radiologist, so that's quite helpful. And so just from talking to people, I think what you need to know the basics, and then you just need to do it on as many patients as you can. Yeah. You need to learn by doing.
Yeah, totally agree. Seems like an inevitable part of our future in this industry.
And it's going to be even harder because there's not that many experts around to ask questions or get some hands-on advice. So when you learn to inject, there's quite a few people to ask for advice for now, and you've got WhatsApp groups and so on.
You've got radiologists who understand how to read read ultrasound, but they don't know anything about injecting principles. And then you've got injectors that know everything about injecting, but don't know anything about ultrasound. So it's almost like we've got to educate
both.
Yeah, educate each other so that we can integrate them into the one practice.
Yeah, that's the problem. You know, speaking to ultrasonographers, they rarely go into a face. They'll do abdomens and chests, legs, and God knows what else to drain things. But they're not very rarely doing faces. So their understanding of what they're looking at is not always great.
Yeah, it's kind of funny when you look back at the industry where, 20 years ago, we're just injecting with impunity in the laser label area. And we know
it was the beginner's teaching.
Yeah, no concept.
So first thing that you'd teach a beginner was how to inject the nasolabial with a sharp needle.
Yeah. So we had no blissfully unaware that
parallel to the
it's like swimming in an ocean full of sharks, but you don't know that they're there. And now we know they're there. And now we're just trying to. So I think.
And now we're obsessed with them. Yeah.
Yeah. Absolutely.
Yeah. Well, where do you see our career going in the next 5 to 10 years, Sarah? We've mentioned ultrasound, but do you think there's going to be any game-changing new products?
Oh my God, always.
Approach things like what have you seen that's got you excited?
Okay, so I think there will always be new products. I think that there is such fast R&D in this area. So what I'm quite interested in at the moment is the skin booster side of things. You guys are getting Profilo soon. That's been really fun.
We were just about this morning.
What was that?
We were just talking about that this morning. We're going to potentially be having a discussion around that at some point soon.
We may. Let's not give any dates because we don't know.
Yes.
Coming soon, we hope.
Yes.
So I think the skin quality side of things is an area that is yet to be explored. So as you're saying, diluted calcium products, the hyaluronic acid products for the skin boosting, skin quality side of things. I think that there's progress to be made in that area. I think the really interesting new toxins coming out, the longer lasting ones, the shorter lasting ones. I think the elastogen company, the combinations there, the combinations of the hyaluronic acid and the calcium hydroxyapatite. I think there's so many new things coming out that, you can't keep up. You just, I want to learn about that. I want to learn about that. So it's constant. Yeah. And so I think some of it is refinements of what we had previously. Stuff that's genuinely groundbreaking, I think, is rare. But I think that our expectations are going to keep increasing, Jake, in terms of the results that we can deliver. And I think it's just constant and endless learning. I would really like to see more safety. Us going on more about safety, and I think ultrasound hopefully telling us a bit more about this massive debate between aspiration and non-aspiration.
Thanks so much for watching the podcast clip. You can listen to the whole audio episode of the podcast on your favorite podcast app, on Apple Podcasts or Spotify. And please also leave us a review on the podcast app.
If you like what we do, please smash the like button, consider subscribing to the channel, and don't forget to hit the bell icon so that you get notified when we release new content.